Thank you so much for allowing me to present today. The title of this project is Venous or PTFE Conduits, a VQI comparison of postoperative outcomes in patients undergoing above or below knee bypass. We have no conflicts of interest or disclosures. For some background on peripheral arterial disease, is that is highly prevalent, affecting 202 million people. It carries a significant morbidity and mortality that can cause chronic limb-threatening ischemia, amputation, even death. The gold standard treatment is revascularization with surgical bypass. There are many different types of conduits that can be used, but the two most common and the two that we're going to analyze in this study are venous or GSV grafts and polytetrafluoroethylene or PTFE conduits. We use the Gonzalez VQI database to gather our data. In the previous literature describing the differences between the PTFE versus venous conduits has been extremely divided. There are some articles favoring venous conduits, saying that it has better primary patency and that it also has higher graft occlusion-free survival. In contrast, for PTFE conduits, some articles state that they have shorter operative time, lower morbidity, and it has preservation of the saphenous vein. Lastly, there is literature showing no preference between the PTFE versus venous conduits, stating that they had similar patency rates, and then also that they had similar outcomes in appropriately selected patients. The limitations and gaps in the literature have mostly been due to the small sample size of these studies and the fact that they're institution specific. Secondly, that there has been an underutilization of the VQI database, and all of these factors combined has led to a lack of consensus as to which type of conduit is best for patients. We aim to answer these questions by looking to determine if venous versus PTFE conduits had any effect on patency, limb salvage rates, postoperative infection rates, and place of discharge. To get to our final cohort of patients, we combined procedural day of data with long-term follow-up data, while also removing any duplicates and patients lost to follow-up to get our final cohort of 37,140 patients. We performed many statistical analyses, the first of which was a multivariate logistic regression. As you can see to the table on the left, venous grafts outperform PTFE conduits in 3 of the post-operative outcomes. So if a patient had a PTFE conduit, they had a 32% lower chance of patency, a 33% higher chance of amputation, and a 32% higher chance of postoperative infection. Discharge destination was the only postoperative outcome that did not result in a significant p-value. These results are also described on the forest plot to the right. Lastly, we performed a propensity score matching model to confirm the results of the multivariate logistic regression, and both of these models yielded the same conclusions. We performed a subgroup analysis. Historically, venous grafts above the knee have been preferred due to better postoperative outcomes, so we wanted to use that as the gold standard and compare it with other combinations in terms of type of conduit and location. And we found that venous grafts above the knee had a 91% probability of remaining patent versus PTFE grafts, which were only 89%. And that was the only postoperative outcome that resulted in a significant p-value. Additionally, we looked at venous graft location with different postoperative outcomes, and we found that for venous grafts above the knee, it had a lower probability of amputation and a higher probability of being discharged home compared to venous grafts below the knee. We hope that these results can guide clinical practice and surgical decision-making, especially that we showed that venous grafts were better than PTFE conduits in 3 of the post-operative outcomes that we measured. Also, we hope to create consensus among the literature, considering that this is the first study answering this question that has used a national database like the VQI. And then lastly, we hope to provide guidance for future studies to improve PTF conduits in patients that are unable to undergo venous conduits. Some limitations: number 1, covariates. Separate models could be run to determine which covariates impact differences and outcomes the most. Secondly, we use binary variables of patent versus occluded when the VQI has a wider definition in the database. And then lastly, future studies could look at other variables that can impact the results as far as length of conduit and also different GSV subtypes. Thank you.
The conventional wisdom is that if you're going below the knee, you'll want to use a vein. And above the knee, there's been some controversy about that, although most of the RCTs have been felt to be underpowered. I think when you presented your results there, you were just talking about fem-pop. Is that correct? Or did you break it down into both above and below knee, comparing the two?
Yeah, we were just looking at fem-pop.
Might be interesting to break it down because there is a lot of concern about crossing the knee joint and the implications of that.
How did you handle prosthetics with other adjuvants, like, for example, a distal vein patch?
I think, so I'm filling in for someone who looked at and gathered the data, but I would have to reach out to her to figure out how we divided that.
Yeah, there's some data to sort of suggest it's not better than the venous, but it's probably better than prosthetic. So it'd be interesting to sort of try to tease that out, I think, a little bit. All right, thank you.